And good morning, I'm Dan DeRosa with 19 News, coming to you from our digital desk. We're going to take you to a news conference that just started in the rotunda of City Hall in downtown Cleveland. It's being held by the Center for Black and Health Equity. For Black Health and Equity, they're really trying to address the negative impacts that the Cleveland community has seen post-COVID-19 for what they say is the lowest life expectancy in the nation. Black community being impacted by gun violence, heart disease, and cancer disproportionately. Let's take you live now to the rotunda of City Hall.
The city and community leaders are expected to collaborate on initiatives to promote health and equity for all residents and visitors to the city. We stand here today to reaffirm our commitment to collaboration with the City Council of Cleveland and its leadership. Data-driven policies highlight inequities, guiding interventions that target vulnerable populations and promote health equity. Our ask today, policies should face the scrutiny of the democratic process instead of being gatekept by leadership. Local policies can address specific health challenges and social determinants unique to a community. Local leads the way. Now we'll hear from Ivanka Hall, Executive Director of the Northeast Ohio Black Health Coalition. Switch. I don't want to mess anybody anything up.
We're going to hear from a number of speakers today. There's no podium set up, so there is a little bit of a transition here from one speaker to the next as the different stations, different photographers and crews there have to switch microphones to our next speaker.
Okay. How are you? Thank you for coming out.
I'm good. Sorry I'm a little late.
That's okay. Hi, I'm Ivanka Hall. I represent the Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. Our work is to create equity by addressing the cumulative impact of racial, economic, environmental, and social justice inequities by working to educate, advocate for, and empower the community. This is so important for us today. One of the things that we do know is that in 2020, the city of Cleveland decided that they wanted to declare racism as a public health crisis. But what has happened since then is, although we have a declaration of a public health crisis, there has been no policies that have been put in place that can actually avert potential other crises from happening. So whether we're talking about cut the salt, healthy food options in meals in children's meals for restaurants, or the lead poisoning crisis around the testing of our children, or the tobacco issues around flavors and menthol, we have actually seen everything stalled at the desk. And so what we want to do is make sure that the citizens of Cleveland understand that there are actually community members that are advocating for them 24/7, 365 days a year to try to make sure that our city council understands the issues that are disproportionately impacting the community, and understanding that the community health needs assessment says that these are the things that are going on with the community, and that there is viable policy solutions that could avert any other crises that we have. So it is important for us today to stand here in unity and talk about why the city of Cleveland must act on the issues that are impacting the city of Cleveland and the citizens within the city of Cleveland. Thank you. Did you go live?
Ready? Good morning. My name is Bishop Shuey. I'm proud to represent the Cuyahoga County Progressive Caucus today. For 9 years, CCPC has stood unwavering in our commitment to putting people over politics, and it's at the core of everything that we do. In Cleveland, the health and well-being of our community should be a priority for our elected officials. The stakes are too high for political gamesmanship to overshadow the urgent needs of our residents. The low life expectancy in Cleveland, coupled with alarming rates of death due to gun violence, heart disease, and cancer, paints a stark picture of a city in crisis. These disparities demand bold, immediate action, yet rather than fostering collaboration, critical public health legislation has been stalled. This obstruction does not just delay progress on legislation, it also perpetuates the inequities and suffering that so many of our residents endure daily. At CCPC, we believe that the power of local government lies in its ability to lead the way on issues that matter most to its constituents. Public health policies rooted in data and driven by compassion can transform lives. We've seen it work before, and we know it can work again if only our leaders rise to the challenge. Today, we call on Cleveland City Council to remember who they serve. This isn't about advancing personal agendas or scoring political points. It's about ensuring that every Cleveland resident, regardless of their zip code, has a fair shot at living a long and healthy life. Thank you.
My name is Reverend Derek Lamont Wade Sr. I am here on behalf of the children of Cuyahoga Metropolitan Housing Authority and those residents who live in the city of Cleveland. I am encouraging the City Council and the leaders to continue to work forward to the health of the children who are affected by lead poisoning. My son Demetrius Wade died of lead poisoning complications September 15, 2011. I would like that the leaders take a hard look at the issues of safety in our community, as well as those children who are affected marginally through education and cognitive skills. We encourage them to continue on. We ask for testing for all children under 5 in Cuyahoga Metropolitan Housing Authority and the city of Cleveland. And that's what we're pushing for, that every child be tested in this city and this county so that we can start to rid this city of the difficulties of the safety, juvenile criminal activity, and all of those things that affect our residents in the city of Cleveland. Thank you.
Hey, Genevieve. We want to get a picture of get y'all over here to this way too.
That's everybody?
And it looks like that's all our speakers for today. Again, this was an opportunity for community activists, and it looks like they're really trying to send a message to the Cleveland City Council and to make sure that they hear, and they were a little bit critical, saying that they need to be playing less politics and looking at the health of the black community in Cleveland and getting some legislation on the books. You heard that they had already designated that racism is a public health emergency. That was done back in 2020, but accusations that there has been no legislation since then to either do anything about it or look look at some of the health issues facing Cleveland's African American population. The one sort of specific request that was made during all of this was right there at the end, considering lead paint. We have seen Mayor Bibbs' administration do quite a bit as far as getting money from the EPA, getting money from around the state to address the lead paint issues in so many of Cleveland's homes, but asking for a new policy that there should be testing for all children under the age of 5 when it comes to their exposure of lead paint. That was really the only specific request that was made today. As you saw, our reporter Aria Janelle was attending this news conference. She will have a complete wrap-up on this request when it comes to equity and health for Cleveland's black community. If we have any other breaking news, it'll be right here on our digital platforms. Until then, look for our 11 o'clock news on CW 43 and then our noon news on Channel 19. I'm Dan DeRose with 19 News. Have a great afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media at Cleveland 19 News.